Hello, this is Dr. Kukreja Kalani, and I'm a practicing homeopath. And today I'll be speaking upon how to understand and prevent diseases during rainy season. So once again, welcome everybody. So we'll explore how the rainy season affects our health, from fungal infections to gastrointestinal issues and bone and joint problems and respiratory complaints, as well as mosquito-borne diseases. The rains are refreshing, but they also bring hidden dangers that affect all age groups. So let's get equipped with knowledge and action. First, we'll talk about the skin infection. The most common which we know about are the fungal infection, which causes athlete's foot, ringworm, jock itch, Candidiasis that occurs in the skin folds or the mouth, and bacterial infections like Folliculitis and impetigo, and also eczema and dermatitis flares. What are the triggers and causes of the same? It is caused because of excessive sweating, or because of the damp clothing, or if you walk barefoot in wet areas, using shared towels or footwear, or poor ventilation. So what is the care and prevention? So basically keep skin folds dry, especially the underarms or groins or between the toes. Use certain creams or which can help prevent accumulation of sweat and dirt at the fold area. Avoid tight synthetic clothing, not to share any personal items, and definitely consult a doctor if the symptoms persist. Now, second, we'll talk about the gastrointestinal diseases. The common illnesses are, the diarrhea, the typhoid, the cholera, hepatitis A and E. And also not to forget that the food poisoning as well as the worm infestation. So what are the triggers and the causes of the gastrointestinal diseases? It's basically because of the contaminated water or the street food that we have. Also the unhygienic handling of the food, poor hand hygiene. And what is the care and prevention? It's important that you drink only filtered or boiled water. Wash all vegetables and fruits thoroughly during this season. Avoid eating raw salads outside, and hand wash before meals. So use of ORS and hydration during the diarrhea, and also the use of probiotics, which can help support the gut health. Now we come to the respiratory issues. The common conditions that we talk about are the cold, the flu, the bronchitis, and the asthma flares. The fungal lung infections like aspergillosis in damp homes. And what are the triggers for this? It could be the mold on the walls and the curtains, sudden changes in the weather, or inhaling of allergens in the humid air. So what is the care and prevention to avoid these respiratory complaints? So basically you can use dehumidifiers or exhaust fans. Keep your curtains clean regularly, and clean up the damp corners. Wear a mask in case you're allergic or asthmatic. Stay warm after getting wet, and steam inhalation can help with congestion. Now we talk about the vector-borne diseases. So what are the major threats that we talk about? It is the dengue, malaria, chikungunya, or leptospirosis. So what are the causes and transmission which can lead to the vector-borne diseases? It's basically the stagnant water, which proves like a breeding ground for mosquitoes. Then the flood water contamination, that a leptospirosis risk because from the infected animal urine. Symptoms which you should watch and be careful about is basically fever with body ache, especially during dengue and chikungunya, high fever with chills that happens in malaria, muscle pain and red eyes, that is leptospirosis. Now what is the care and prevention? So remove the stagnant water, the plant pots, coolers and drains. Wear full sleeved clothes. Use mosquito repellents and nets. Not to wade through the flood water without protection, and definitely consult a physician or a doctor if the fever persists beyond 2 days. Now we come to the joint and the bone health. The common complaints are basically the arthritis flare-ups, joint stiffness and pain due to humidity, or old injuries start aching. Now, what are the causes of the joint and bone health diseases? It's basically drop in the atmospheric pressure which affects the joint fluid. Secondly, the sedentary lifestyle during the rainy season. And what is the care and prevention? So as to prevent any bone or joint diseases, stay active indoors, that is gentle stretching or yoga, use warm compresses, and an anti-inflammatory diet consisting of turmeric, ginger, or multivitamins such as omega-3 can prove helpful. Avoid cold, damp floors and use of vitamin D and calcium supplementation if needed. Now, what are the eye and ear infections? So, common diseases or common complaints that we hear about, the same is basically conjunctivitis, ties, or fungal ear infections. So, what are the triggers for the same? It's because of the rubbing of the eyes with the dirty hands, accumulated water in the ears, damp headphones on or hearing aids. So, what is the care and prevention? Basically, you need to avoid touching your eyes, keep your ears dry, clean, and earbuds you can use so as to keep the ears clean. And next is use of clean towels and pillowcases. You should need to consult a doctor if the redness persists or the discharge from the eyes or ears still persists in spite of taking the precautions. Now, what are the general prevention tips during this rainy season? So basically, you need to drink clean water, avoid street food, keep surroundings dry and mold free, bathe after getting drenched in the rain, wear appropriate rain gear, boost immunity with citrus fruits and multivitamins, as well as use of probiotics can prove helpful. Keep first aid and medications handy. Don't ignore persistent symptoms, especially